Hi, everybody. Welcome back. I hope you're all doing well, safe, and sound, and hope you're able to access food and everything else where you live. I know things are continuing to change, and hopefully everything's good in your area. Where I am right now, things are starting to. I think we're getting more infections where I am, and it's starting to get a little bit worse, but it's still not as bad as a lot of big cities. So today I wanted to talk about what I've kind of feared. I heard rumors coming out of China, actually around January, I believe it was, where there was discussions of this being. There was a few different things that were very concerning, but the first one was that this being a permanent issue for the person that was infected. So permanent damage to the body. And it was interesting that I heard this in January and we're hearing about this now in North America. I find that the lag time for North America is about 3 months, unfortunately. So there were many things that came out in December even. One of them was, of course, wear a mask. This is highly contagious. This is spreading very quickly. The R naught's very high. The case fatality rate is going to be very high. And all of that was kind of denied in North America. And then even now, we're still not catching on. I don't know why. But so back then, one of the things that was also discussed was that this could cause permanent damage. The other thing, of course, which I haven't talked about yet, was the different variations or strains or mutations of this as well. Although that wasn't discussed as much. But the permanent damage thing definitely was. And I was hoping that that was not true. So I haven't talked about this before. But what we've seen in China is that they're doing things like lung transplants, which I've never heard of before. And from the videos that I saw, it seems like this is a relatively new thing that they're doing. And I would assume there's a fair bit of risk to that. There's also some controversy around where did they get the lungs from? And I don't know if we'll ever know the answer to that. But yeah, so there was a lot of questions there. However, I think the biggest issue for us is how serious is COVID-19 as far as if you survive, what should you be thinking about, right? In the way of permanent damage. So I've got a bunch of articles that I want to go over with you because I'm hearing more and more about it now in North America. There's enough people infected, there's enough people that have recovered where we should be able to get a good idea of what your risk is to have permanent damage from this. And I think based on the research that I've done, that it's fairly significant, right? I think that we see some red herrings a little bit with this, but I don't know, you be the judge, okay? And you tell me what you think. I'd appreciate that. But let's start off with the first one that I'm gonna go over. And of course, like any good researcher, I went to Reddit because of course, everything in Reddit is true and polite and really nice, right? Yeah, not so much. But anyway, there is a good article in there with some good discussion about people that were not only infected with COVID-19, but also with swine flu, PAX, and different things like that. So, and the comparison of those, excuse me, as far as what that looks like after the fact, right? So I think there's two things. There's permanent damage, and then there's damage that just takes a long time to heal. And if it's long enough, then of course it's kind of similar to permanent. And if you're a performance athlete, then that's definitely going to slow you down a lot and be more of an issue. If you don't move very much, then maybe it's less of an issue. But I'm going to put all these links down below so you can take a look at them and see for yourself, do some research, tell me what you think. So the first one, they talk about people infected with swine flu and PAX sometimes took months for their lungs to recover. Okay, so that's kind of the baseline I think that we should be looking at here. So if you have complications, if you're put on the machine to help you breathe, then your lungs are impacted, of course. You might have pneumonia, you might have lung infection, you're going to have some issues. You're looking probably at months for your lungs to recover. And I think that's to be expected. I think most doctors would probably agree to that. I think that you might come out of the hospital in weeks, but you're not going to be running a marathon in the next year, probably. So that's something to think about. That's not that bad, really, in the grand scheme of things, right? I think that it's not good, but most of us aren't lined up to run a marathon anyway. So I think that's okay. I think that's kind of to be expected. So the next article I have was on newsscientist.com. That sounds legitimate. The article looks legitimate. I'll put the links below. So they said we found fibrosis, and excuse my pronunciation, I'm terrible at it. It says we found fibrosis, which in brackets says scarring, so I guess that means scarring, in the lungs. And that's what I heard as well. So scarring that just doesn't necessarily heal or doesn't heal very quickly. So we found fibrosis, scarring in the lungs, but we don't know if that's reversible. And that is Osamah Alwalid, a radiologist at Wuhan Union Hospital. So, right in the center of it, right? And so I would say that's pretty interesting. So we don't know if that is reversible. That would mean to me that it's fairly significant, which is not good. The next article I found from the ScienceDaily.com, again, sounds legitimate. Take a look at it. Links down below. Unlike SARS and MERS, while initial chest imaging abnormalities are more frequently unilateral, COVID-19 is more likely to involve both lungs on initial imaging. And that doesn't sound good. I mean, we know this is a respiratory issue with this infection, but it hits both of your lungs, which doesn't sound very, very good because, if one's gone, then maybe you can use the other one. But so I thought that was quite interesting. That doesn't really play to the permanent part of it, but it's kind of showing the impact of it. The next one I have was from CNN, so that's just a news station, but they were interviewing this person, and they said for these patients who essentially present in progressive respiratory failure, the damage to the lungs is rapid and widespread. And there was a video of it too in this link. Mortman said in the email, unfortunately, once damaged to this degree, the lungs can take a long time to heal. For approximately 2 to 4%, depending on the numbers that you believe, of patients with COVID-19, the damage is irreversible and they will succumb to the disease. Oh, okay, so those are the ones where they don't survive the initial infection. So I think that's a bit of the confusion, is people are saying, well, it's permanent damage, but those are the people that don't make it through anyway. Those are not the survivors that come out of the hospital but still have permanent damage. So there could be some confusion here, but let's keep going. Then there's this thing that I found, this term that I found, which sounds really scary, and that's ground glass. If you Google for permanent lung damage, COVID-19, coronavirus, whatever it's called these days, you'll find ground glass written down a lot. And I thought, when I read that, I thought, wow, that sounds really bad. I don't want ground glass in my lungs because, yeah, that just does not sound good. But it's actually just on the CT scan, it sounds like that's just simply what they see. It kind of looks like that, and that's a sign that your lungs are not good. It's not as, it's serious, I guess, but yeah, it's not really exactly what I thought. So they go on to say here, this source is from the rsna.org, which is it's a radiologic findings and literature review. Imaging profile of the COVID-19 infection. This is a fairly scientific study. It looks like some very good detail, very good diagram, very good outline of what's going on there. Ground glass in consolidative optic, I can't say that word, visible on CT are sometimes undetectable on chest radiographs, suggesting that a CT scan is more sensitive imaging modality for investigation, which makes sense. So there's that. What is ground glass? Yeah, that was the big question that I had. And really, they're just saying it's a pattern that can be seen when the lungs are sick. So it's not where they're actually finding like these weird little things that are cutting up your lungs. That's not what it was. That's the image I had in my mind. So the final article that I have, and this is probably the best one to look at, is from the rainnews.it. And IT might be Italian, I think. I had to translate it. And so, but this is the one that I found the most interesting so far on, what kind of permanent damage should some people expect. And he starts off, let's see here. This is from the Innsbruck University Clinic. And so I think that sounds relatively legitimate. And it's Frank Hartig. It sounds like the senior physician of the Innsbruck University Clinic. He starts off by saying it is now undisputed that COVID-19 should be taken seriously as a serious illness. And well, we knew that already. He heads the emergency department in the hospital and is responsible for crisis coordinator for COVID-19 patients. He says, and this is in quotes, the damage to the lungs is irreversible. Well, all of them were not severe cases. Their illnesses were 5 to 6 weeks ago, and they are considered to be recovered, but they can no longer dive. Oh, this was good. So he actually had some divers that dive in the ocean that were 6 active divers, all of whom were not treated in the hospital, but cured themselves while at home in quarantines. All of them were not severe cases. Their illnesses were 5 to 6 weeks ago, right? And they fully recovered. But the lung damage, they're saying, is irreversible. So that is pretty interesting, right? I was pretty amazed by that. So they're athletes, they go home, they're all good, but their lungs are, for the most part, like they're wrecked as far as doing what they used to do as a sport, right? He goes on to say, this is shocking. We don't understand what's going on here. That's not good. That's not good. He says they are probably the CT scans. That's what you want to have done. That's what they were doing in China. And they found that more reliable way of testing, which was interesting. They changed the testing a couple times, which we thought was really weird. They didn't get any better at all in imaging, said Hartig. As an emergency doctor with 20 years of experience, you swallow when you see something like this in a 40-year-old patient. Whew. Right? Those are pretty chilling words to hear. So I think that the conclusion, therefore, is that, yes, I would say, based on what I've read so far, and there is not a lot of details out there on this yet. I think there's much more detail on this in Wuhan, in China. So if you have articles that we can translate, please put them in the comments down below. Because I think that this will slowly emerge over the next month or two based on our timeline to absorb what's coming out of China. It seems like we're kind of about 3 to maybe 4 months behind what's obvious over there. And I don't know why. I don't know why it takes us so long to do that. But that's what it seems like so far. So, yeah. It's bad news. So if you do get it, I think that you want to try to get through it the best you can, and hopefully you don't suffer that fate with permanent damage to your lungs. I don't know how to avoid it. So if there's any tips out there on how to avoid that, how to make your chances better at not getting permanent damage, that would be really interesting to hear about. So yeah, I mean, I don't know of anything you can do really. I think that one of the things that I would suggest, but I don't know, right? But what I would suggest based on the research is, of course, limiting your exposure, but then limiting your exposure to a more massive dose of the virus. So that's what they talk about a lot with the particles and things like that. Wearing a mask reduces the chance of you getting a very large dose. And a lot of the doctors and nurses and healthcare practitioners that have gotten this, some of those fatalities, they are associated with getting, and I don't know how this works exactly, getting more of a bigger dose of the virus all at once. And so, and that sort of makes sense to me. I don't fully understand how that would work, but I suppose it does make sense. So perhaps if that was to occur, you're more likely to get damage. I'm just guessing. So, but I think wearing masks, wearing your PPE, being as careful as we can, having a healthy lifestyle, trying to eat right, don't drink too much, get plenty of sleep, all those like things your mom told you to do. I think now is a good time to be doing all of that. So that's it. Hopefully that was interesting for you. If you have any information on that, I'd love to hear about it. Please put it in the comments down below, and we can have a bit of a discussion on that. If you like this video, please hit the like button. It tells me what kind of content you prefer. And if you want to be alerted to new videos, please hit the subscribe button, and the little bell button there will alert you when I upload a new video. So, yeah, that's it. Thanks a lot. Stay safe. See you later.